class number 8, and it is spherocytosis. Spherocytosis can come as an essay question also. Basically, it is a defect in the red cell membrane. When I talk about the red cell structure, this is the cell membrane and this is called the cytoskeleton. There are two structures which I should remember. One is called the spectrin. There are two of these, alpha and beta, they are intertwined and they act something like a cytoskeleton. They are also being reinforced to the cell membrane by means of 4.1 or 4.2 and Ankyrin. Therefore, a defect in any of this can be leading to the spherocyte formation. So the entire list I would like you people to by heart. This is a beautiful diagram. So spectrin, there can be a decreased stability, membrane is lost, it becomes small and spherical, stagnation, and so on and so forth. This is what is happening. Normally, this is the malleable, the biconcave disc that we see. But you find that every time it becomes rigid, part of the cell membrane gets pinched off. It gets pinched off repeatedly, and they are being devoured by the phagocytic cells. Ultimately, the cell assumes the smallest size, and that smallest size is equal to the spherocyte. It is finally devoured or eaten by the phagocytic cells. Patient can present with anemia, jaundice, splenomegaly, and there are some crises, anemic crisis and hemolytic crisis. Cholecystitis is important. This can be given as a history. Pigmented gallstones are present in spherocytosis. This is a very important diagram which I would like you people to see. So normal RBC is somewhat a biconcave disc. But when there is going to be a defect in Ankyrin, spectrin, etc., gradually you find that they are being devoured and the cell is being released as microvesicles. Ultimately, there is a spherocyte that is getting formed. And this spherocyte is very rigid. It gets trapped in the splenic sinusoids. And splenic sinusoids means it will be eaten up by the phagocytic cells or the histiocytes. And this also leads to lower pH, increased macrophage contact. Finally, there is a hemolysis. Initially, it is only part of the membrane. Ultimately, there is a total lysis. I would like you people to explain and draw this. This is the peripheral blood picture wherein I am having the RBCs are normocytic, normochromic, mild variation, anisocytosis. Because of the destruction, immature cells or reticulocytes will be formed. Look at these purplish cells. They are the polychromatic cells of the reticulocytes. Owl jolly bodies may be present. The hemoglobin is reduced. Serum bilirubin can be 4 to 6 or even more. The normal RBC is malleable and it can pass through very narrow cracks and crevices, which the spherocyte cannot do. The other investigations can be the cholecystogram to rule out gallstones. And for hemosiderosis, etc., a biopsy might be needed. The differential diagnosis for this condition can be, it can also be acquired, as in the case of burns, autoimmune hemolytic anemia, hemolytic disease of the newborn, etc. Otherwise, it is an acquired autoimmune disorder. The treatment will be supportive, splenectomy if it is going to be persistent. And there has to be the treatment of the infection. I would like you people to kindly note this differential diagnosis. This is the osmotic fragility test. Normally, you find that there is a different concentration of saline over here. This is a normal blood sample and this is the spherocytic sample. The spherocytosis, you find hemolysis will be starting at a very early stage, 0.8 itself. And whereas in the case of a normal blood, it will be starting only around 0.5. This is a very sensitive test that can be done for spherocytosis. Thank you.